So about 3 weeks ago, almost exactly to the day, I tore my LCL doing BJJ, Brazilian Jiu-Jitsu. So I just wanted to make this video because I couldn't, when I first tore it, when I first injured my knee, I didn't even know exactly what it was that I had done to it, but I wanted to see, I was trying to look around as you do. You play Dr. Google and Dr. YouTube and try and figure out what it is that you've done and how severe it is and how long you'll be out for. And I thought it might as well be worth me documenting like what I had done, how severe it was, and also how my recovery was going and sort of my level of, I don't know, ability, mobility, all that sort of stuff. So this is all obviously just purely anecdotal. This obviously isn't medical advice. I don't need to say that. But anyway, so what happened was I've been training jiu-jitsu for around about 2 and a bit years now. And I got my blue belt not long ago. And I went through a phase with work and just the classic thing of being a blue belt where you just get your blue belt and quit. But no, I went through a phase with work where I just couldn't train for a while, pretty much for the start of this year. Like for the first 4 months or so, I think I trained a grand total of probably 3 or 4 times. And I was away a lot with work, and then I finally got back into it when I was not away anymore. Sorry, I'm being pestered to throw this ball. But yeah, so I finally got back into it, and long story short, pretty much went too hard too fast, which is just a classic. I'm 30 now, so I'm nearly, I'm at that perfect age where you think you're really robust and strong and nothing's ever gonna go wrong, but the reality of breaking a little bit more easily hasn't set in, and yeah, so I went too hard too fast. And I was rolling with this younger dude that's a white belt that's pretty good, and which sounds pretty like wanky of me to say like, oh, he's pretty good for a young white belt, like I'm a blue belt, like I'm nothing. But anyway, he had me in a straight ankle lock, and it wasn't quite on, but he was cranking the living shit out of it, and I sort of got annoyed, which I shouldn't have, and I basically, it's kind of hard to describe the position I was in, but I was sort of on my ass and he had a straight ankle lock on me, and it was in my left foot, so it's my left knee that's on the floor with my left ass cheek down, and I pretty much tried to come over the top and I was trying to get to a position where I could sink the boot in a bit deeper so that he didn't really have the submission anymore. And I just did something, I don't know exactly what I did, but I basically brought my torso up and over and didn't really put the boot on as hard as I should have to sort of go with the movement of my torso. And basically my knee and leg stayed in one position as I crunched up with my torso, and my knee just popped outwards, and there was the classic loud like carrot snapping sound. Everyone stopped and looked around, and I was like, yep, I've just done a knee. It surprisingly wasn't that painful when I did, like it definitely hurt, but it wasn't, like I've heard about knee injuries, people say like you're screaming on the ground and it's, you know, one of the worst pains you can experience is like a really traumatic knee injury. So I knew it was a knee injury. It hurt a moderate amount, but not too bad. And I thought I wasn't too bad. I jumped in the car straight away because I drive a manual, and I was like, I don't want to wait for it to swell up or get too sore that I can't use the clutch. So I went home. I got up in the morning. I was really, really sore the next morning and could barely walk, and I was like, okay, something's definitely wrong. And then I went to the doctor, I went to a sports doctor, and I got an x-ray because he was thinking that maybe I might have chipped the top of the bone off the tibia or something like that, or when a ligament might have detached or the muscle tore or something, it can sometimes pull a bit of the bone off. I definitely didn't think it was anything that extreme because I think that's when I would have been howling and screaming on the ground, but did the x-ray, there was nothing wrong with the x-ray, and then he sent me for an MRI, and I'll flash the whole sort of summary of the diagnosis of what they said and some of the images on screen from what I took sort of screenshots of. But basically it's a high grade 2 LCL tear. So LCL is the ligament that goes down the outside of your knee, and MCL is the one on the inside. I had it back to front, but yeah, LCL is the one down the outside because the knee buckled out. And so you get tears in grades 1, 2, and 3, 3 being the most severe. So it's a high grade 2. And when I went back and saw him, he was acting pretty grave, and he said, "Oh, you know, you've done quite a significant injury to your knee." And I start thinking the worst, thinking I'm going to need surgery. And he said that he was going to give me a referral to the surgeon. He said I definitely needed to be in a straight, in like a knee brace, what do you call it? A hinge knee brace. So I think it just allows for forward and back movement, but really restricts any sort of lateral movement so that you can't, because the knee's obviously loose and wobbly in that direction where the ligament usually keeps it firm and in sort of a straight back and forth plane. And I don't know, like I was sort of hobbling. He wanted me on crutches, but I could kind of manage without crutches. I'm kind of bad for taking doctors' advice and stuff like that with a bit of a grain of salt and kind of doing my own thing, which I know isn't really advisable and probably speaks to a high level of hubris that I just think I know better sometimes. But I've had a lot of bad experiences with GPs. And anyway, so I got a really tight knee brace, but I didn't end up going and getting the hinge knee brace because I have a dog poo to pick up. Yeah, so I didn't go and end up getting the hinge knee brace, and I've just been in like a really tight, like the most restrictive knee brace that you can just get from a chemist or a pharmacy. And I've been in that for 3 weeks, and I'm now out of that because I feel like I can walk pretty normally without it. But the appointment with the orthopedic surgeon that he booked for me is scheduled for this afternoon. So I have that in like an hour or so after this. So I'm gonna go to that. Again, I'm gonna take whatever I hear with a pinch of salt, because I don't know, just from what I've heard from other people, surgeons are just knife happy. They just want to default to cutting you open. But I've talked to a lot of people, and they say that with LCL and MCL injuries, or more so LCL because that's what I was looking at, the sort of the current, I don't know, wisdom or wave of thought in the medical community is that that they should almost not need surgery ever. Even some grade 3 tears don't need surgery. So basically, I'll be surprised if the surgeon this afternoon tells me that I need surgery. And if he does, he'll have to really lay out a pretty convincing case that it would be dire straits if I were to not get the surgery for me to consider getting it. Not that I'm like scared of getting surgery or whatever. It's just, I don't know, from everything I've heard and read so far, which I know if there's any like doctors or physios or anything like that listening, they'll be cringing out of their skin going like, oh my God, this guy's just going off shit that he's Googled and YouTubed. But there was one good channel I found. I think it was a South African physio or whatever she is. I'll put that on the screen, but she had a lot of good videos and advice about LCL injuries. And they cited one study saying that there was, I think it was a bunch of NFL players that all had very similar LCL injuries. And they had one group of the study all get surgery, and one group of the other half of the sample population, or whatever you call it, not do that and just do physio and rehab without like anything invasive. And all of that latter group ended up recovering much faster and stronger and with just as good like results without any sort of invasive procedures to sort of rectify it. So yeah, I'm 3 weeks out. I'm still pretty tender. And yeah, we'll see what the surgeon says this afternoon. So let's go and do that. So not the best outcome, or I mean, not the outcome I was expecting. I'm now in the hinge knee brace that I was supposed to be in, I think from the start of the injury that they told me that I was supposed to be in. So yeah, not great, but basically I think that was just the surgeon being cautious, putting me in the hinge knee brace. He said that it's progressed to a point now with the amount of mobility that I've got that I shouldn't need surgery, but I have to have a check up in another couple of weeks. But can't load it up with anything heavier than 5 to 10 kilograms apparently. So I can't pick up anything heavier than that, and it needs to stay in the hinge brace until the next appointment in like 3 or 4 weeks time. I can tell you right now, this hinge brace is coming straight off. I know that may sound stupid, but it doesn't feel any more protective or stabilizing than the normal super tight knee wrap that I had on it. It's extremely annoying, and I'm just not going to hobble around in a hinge knee brace for the next couple of weeks, and I'll just manage the injury. And I know that with all that stuff, doctors will always default to the safest protocol they can to cover themselves. So I feel like there's a safety factor that they build into what they want you to do that you can sort of turn around and minus. But yeah, so he basically said to me what the first doctor said to me. He's like, oh, I've seen people get better from this injury all the time without needing any invasive surgery. But he wasn't as gung-ho about saying that because he was a surgeon himself. I knew that would happen. I knew the guy that makes his entire career and living off cutting open knees is not going to come out straight out and just say, yeah, we don't need to cut this. Like, it's almost never a good idea to cut the knee open. And he just said that particularly for isolated injuries like that, so with the knee, if the whole knee's not fucked, if it's just the one tendon or the one ligament or whatever, we have a visitor, then yeah, he did admit to the fact that a lot of the time it'll just get better on its own with decent rehab and staying off it. So yeah, the hinge knee brace, I mean, if you're watching this because you've done a similar injury, chances are, unless it's completely torn off and it's multiple ligaments torn throughout the knee, you shouldn't need surgery, and just do physio. And if you're watching this out there because you've done this injury and the first person you've spoken to, whether that's a surgeon or the doctor or whatever, has said, yes, we're doing surgery, like it definitely needs surgery, just get a second opinion. Because I brought up the thing with the surgeon about how there being a new wave of information coming out, and a new way of thinking that, you know, surgery is almost never a good option for knees. And I could tell he was annoyed when he heard that, because he's definitely hearing that from multiple other people and has heard other people saying it. So yeah, basically, all I'm trying to say is, if someone advises you that you need to get surgery for an LCL injury, just maybe reconsider it and get a second opinion, because I'll do an update to this video in a couple of weeks, but I honestly feel like and there was only a tiny little bit of instability when they checked the knee compared to the other knee. So yeah, I'll do an update in a couple of weeks of how I'm going, but I reckon I'll be back to playing sport and doing jiu-jitsu. I'll play it safe. I would say at least 2 months, and I'll be active and diligent about the rehab. I've said it out loud in public now, so I actually have to do it. So, yeah.